Hi, this is the last video lecture for Chapter 2, where we'll be talking about some other common terms, what a teaching hospital is, residence, and other items in healthcare insurance. And again, one of the things that we see sometimes are the consumer-directed health plans. Basically, these are your healthcare spending accounts. So in other words, you take some money pre-tax, it's put away much like a 401k is, and then you can use that amount of money to pay for deductibles, co-pays, and some of these other things. Something that drives the healthcare insurance industry and makes care affordable, effective, is healthcare documentation. Healthcare documentation has to be legible, complete, and timely. And this is required by the Medicare Conditions with Participation Joint Commission standards and most, if not all, health insurance payers. Providers are responsible for correcting or altering errors in patient record documentation. We commonly call this as addendums. Even in electronic health records, when you go and edit a health record, it is showing you when it was addended. So something very important to keep in mind. The term teaching hospitals is used often. Teaching hospitals are hospitals that have physicians who are licensed physicians, but in training, these are referred to as residents, interns, fellows. And there are documentation guidelines on the CMS website and with healthcare insurance payers that tell the attending physician, in other words, the teaching physician, how things are documented. There's certain verbiage, for instance, that the teaching physician has to have in the note saying, I've reviewed the resident's care plan and agree, so on and so forth, these types of things. See if we can get some examples of that to share with you. And so what is a teaching hospital? A teaching hospital gets higher Medicare reimbursement because it's an improved graduate medical education. And since these have higher overhead, they need to meet certain criteria so they can have residency programs. Probably the most common one we see are the primary care physicians, but we also have residents in dentistry, podiatry, and other services. Teaching physicians, also known as attending physicians, are physicians who basically instruct and oversee the residents who are caring for patients. Documentation, of course, is the basis for coding. If you've taken one of our coding courses, you know this very well. Documentation must support the codes that are reported on claims for a third-party payer. And the patient diagnosis has to justify all the services. So again, back to the idea of medical necessity. And with electronic health records, it's been both a blessing and a curse. The blessing, well, things are a lot easier to read. The curse, now people can copy and paste, drag things in from the problem list, and do all kinds of things which may or may not be appropriate. And again, last bullet point I should have put in red, if it wasn't documented, it wasn't done. Right. So an example of this, years ago, I worked at a children's hospital and they would write orders for respiratory therapy for neonates in the NICU. And when they were discharged, obviously they didn't go home with room oxygen, right? But if they didn't write an order to take them off, it was considered invalid and the payer wouldn't pay for it. So if it wasn't documented, it wasn't done. Records, electronic medical records, they sound like the same. Are they the same? Well, let's watch and find out. Electronic health records are more global. They include patient information that's documented by a number of different providers. So it's not just that one kind of flat record, if you will. And then it links things, so it allows information to be created at different locations. And this, of course, involves a unique patient identifier. The advantages: we have complete and accurate medical records. And then typically these are linked. At Kaiser Permanente, they use the electronic health record by a vendor known as Epic, and it links with the clinical library. And that way, if they need access to a clinical pathway, in other words, a recommended path for, say, abdominal pain or something, it's right there. They don't have to leave, go and try to find it or whatnot, or keep it on a little index card like we had to have providers do years ago. And it basically streamlines a provider's workflow. This is probably the biggest challenge with electronic health records, is it totally upended everybody's workflow. So a lot of thought when we implemented electronic health records about how workflows need to be improved. And again, one of the great things about it, now we can do all kinds of data collection, right? So an example of this is the COVID-19 vaccine, right? Now all this information is available electronically, resulting in vaccines being created in a few months that formerly took years. Electronic medical records are a little bit more singular. It's more narrow. And so it's basically for a single medical practice. So an example of this is, I have a primary care physician. He has his own office. He has my medication list, problem list, notes, what have you. And it's not integrated with a schedule. It's not integrated with anybody else's records. So a little bit more of a narrow focus, but a lot of the same benefits. It's legible. It has all my medication list, all my information, what have you. The total practice management software, a lot of these are integrated with electronic health records, and this includes such things as appointments, inboxes, claims, patient registration, and so on.